3 years ago, my mother was prescribed 6 medications. She was 71. She was careful. She took every pill exactly as her doctor told her. I got the call at 6:52 in the morning. She had just taken her medications. 20 minutes later, she was on the kitchen floor. She spent 11 days in the hospital. When I reviewed every medication she was on, I found it. A combination the FDA had formally flagged as dangerous for adults over 65, 5 years before her collapse. Nobody told her. Last year, over 700,000 American seniors were hospitalized for drug interactions. Not overdoses, interactions between medications their own doctors prescribed. 5 specific combinations are responsible for the majority of those hospitalizations, and they may be sitting in your medicine cabinet right now. I'm not here to frighten you away from your medications. I'm here to give you information the system doesn't require anyone to give you. The CDC reports that 68% of adults over 65 take 5 or more prescription medications. The 5 combinations I'm about to show you involve drugs sold at every pharmacy in America: ibuprofen, blood thinners, blood pressure medications, statins, antibiotics. Let's start with number 5. Combination 5 NSAIDs, ibuprofen, Advil, Aleve, naproxen. Blood thinners: Warfarin, Eliquis, Xarelto. Blood thinners reduce your blood's ability to clot. NSAIDs thin the lining of your stomach and GI tract. Combined, you have a drug preventing clotting working alongside a drug that creates microscopic tears in your GI tract. Your body cannot stop bleeding from wounds it is constantly creating. The FDA has placed a black box warning on this combination, their most serious warning level. A 2014 study found seniors on this combination had a 3.5 times higher risk of a major bleeding event. 3.5 times. If you take a blood thinner and regularly use ibuprofen for arthritis or pain, this is question 1 for your pharmacist. I'll give you the exact wording at the end. Number 4 is more dangerous because you won't see it coming. Combination 4 ACE inhibitors, Lisinopril, Enalapril, Ramipril, are among the most prescribed blood pressure medications in the world. They cause your kidneys to retain potassium. Many seniors also take potassium supplements, or a diuretic called spironolactone, which is potassium sparing. When you combine these, potassium accumulates in your bloodstream faster than your kidneys can clear it. Your heart runs on electrical signals. Potassium regulates those signals. Think of it as a dimmer switch controlling when and how powerfully your heart fires. When potassium accumulates beyond safe levels, that dimmer starts behaving unpredictably. The signals that tell your heart when to beat begin to misfire, not occasionally, randomly. And the terrifying part, you will feel nothing until your heart stutters. A 2022 American Heart Association review found this combination responsible for a significant portion of cardiac arrhythmia hospitalizations in adults over 70. If you take any ACE inhibitor and a potassium supplement, even over the counter, write this down as question 2. Number 3 is the one that is going to stop you cold. Combination 3 involves a medication 35 million American seniors take every single day, and something that has never once carried a warning label about this interaction. Something sitting in your bathroom cabinet right now. Stay with me. Combination 3. Statins: atorvastatin, Simvastatin, Lipitor, Zocor. Over 35 million Americans take a statin every day to manage cholesterol. And statins have a property most people who take them are never told about. Statins are metabolized, broken down by a specific enzyme in your liver. Several common medications and supplements block that enzyme. When it's blocked, statins can't be broken down at the normal rate. They accumulate in your bloodstream, and statin levels 5 to 10 times higher than intended begin to destroy muscle tissue. The condition is called rhabdomyolysis, a breakdown of muscle fiber into the bloodstream that can cause kidney failure. The FDA issued a formal warning about this in 2012 and updated it in 2021. The warning has existed for over a decade. What blocks this enzyme? Clarithromycin, a common antibiotic prescribed for respiratory infections. Fluconazole, a common antifungal. High-dose niacin, sold over the counter as a cholesterol supplement. And grapefruit seed extract, found in immune support supplements at virtually every pharmacy in America. No prescription required, no warning label. Gloria was 71. She had been on Simvastatin for 4 years with no problems. Her doctor prescribed clarithromycin for a chest cold, a routine antibiotic. Nobody flagged the interaction. Within 8 days, Gloria couldn't get out of bed. She thought it was the flu. It wasn't. Her statin levels had reached 9 times their normal concentration. Her kidneys began to fail. 3 weeks in the hospital. Her specialist told her family, "We see this more often than people know." And almost every time, the patient had no idea the combination was dangerous. If you take any statin and have been prescribed an antibiotic, for any reason, or if you take niacin or any supplement containing grapefruit extract, this is on your list. The question is at the end. Number 2 is one seniors discover only when it's almost too late. Combination 2. Warfarin is one of the most drug-sensitive medications in existence. Introducing almost any other drug can push its levels dangerously high or dangerously low. A 73-year-old named Walter filled a routine antibiotic prescription for a tooth infection. By Thursday, 2 days later, he was in the emergency room. His warfarin's blood-thinning effect had more than doubled from a single 5-day antibiotic course. The antibiotic was metronidazole, prescribed at dental offices across America every single day. Research shows metronidazole can increase warfarin's blood-thinning effect by up to 50%. Not a rounding error. 50% more potent from the same dose. High-dose vitamin E and fish oil both thin the blood independently. Most seniors never mention these to their doctor because they don't consider supplements medication. They are. If you take warfarin and are prescribed any antibiotic for any reason, or if you take fish oil or vitamin E, initiate that conversation before your next dose. Don't wait for your doctor to ask. They may not know to. Number 1 is the combination you can verify yourself right now before this video ends. Combination 1. The final combination is not hiding in a pharmacy. It's hiding in your refrigerator. Grapefruit. A 2012 paper in the Canadian Medical Association Journal identified over 85 prescription medications that interact with grapefruit, 43 capable of serious adverse events. Grapefruit contains compounds that block the same enzyme I described with statins. For blood pressure medications like felodipine, grapefruit can amplify the drug's concentration by up to 300%. Read that again, 300%, the equivalent of 4 doses from a single pill. And the effect isn't neutralized by spacing them apart. Grapefruit's enzyme blocking effect lasts up to 72 hours. 1 glass on Sunday can affect your medication on Tuesday. Right now, go to your medication bottles. Search the name of each one followed by the word grapefruit. The FDA's free drug interaction checker tells you in 30 seconds. Do this today. I promised you 3 questions. Here they are. Write these down. Save this video. These are for your pharmacist, not just your doctor. Pharmacists have access to your complete medication history from every prescription you've filled. Their entire specialty is the interaction between drugs. They are the most underused resource in American healthcare. The 3-question safety card. Question 1. Looking at all of my current medications together, not each one individually, are there any combinations that carry a higher risk for someone my age? Question 2. I take my medication. Are there any over-the-counter pain relievers, antibiotics, or supplements I should specifically avoid or flag you about before taking? Question 3. Does anything on my current prescription list interact with grapefruit or grapefruit-derived supplements? Print this. Keep it in your wallet. Take it to your next pharmacy visit. A good pharmacist will not only answer these questions, they will print you an interaction report. They will flag anything that warrants a call to your doctor. You have the right to that conversation. And now, you have the words to start it. I want to tell you how my mother is doing. She is 74 now. After her hospitalization, her care team did a complete medication review. They found 2 more combinations that hadn't caused a crisis yet, but were moving in that direction. Both were adjusted. She hasn't been hospitalized since. She gardens in the mornings. She calls me on Sundays. She is fine. But I think about every person watching this who doesn't yet know what we know. Every person whose medicine cabinet contains a combination no one has ever flagged. Every person doing everything right, taking their medications faithfully, trusting the system, and who deserves the information the system was never designed to surface for them automatically. That is why this video exists. And if it helped you, share it. Not for the views. For the person in your life who takes 6 medications and has never once asked about interactions. For the parent, the neighbor, the friend. They deserve to know. This channel exists for one reason: to surface the information your healthcare system has, but doesn't surface for you automatically. If that matters to you, subscribe and turn on the bell. Leave the word SAFE in the comments if you're taking these questions to your pharmacist this week. I read every one. The FDA's free drug interaction database is linked in the description below. Take care of yourself.